In the last few months, year or so, there's been an incredible coming together of minds around the fact that the pediatric epidemic is far from over. We've made some wonderful strides, and we should celebrate those, but there is still much work to be done. This morning is about how do we make sure that children don't fall through the cracks, but also those that get onto treatment, how do we make sure that they make it into adulthood? So it's my great pleasure to announce that the CIPHER grant is continuing. There are a number of research gaps that remain, things we don't know. And so through this grant program, and through the CIPHER collaboration as a whole, we are growing a crop of young researchers who are given the task of making sure that they actually address some pediatric or adolescent issues in resource-limited settings. In addition, the collaboration in cohort work goes on. And I want to tell you, this is the most extraordinary collaboration around the world. So CIPHER has been able to gather cohorts, pediatric and adolescent cohorts from around the world. We have 250,000 children in our cohort data bank. And we will be able to answer the really big questions that otherwise could not be answered in single cohorts on their own.
We've had a lot of progress in the HIV global epidemic response that has been discussed over these past few days. But I think a message that we want to get across to all of you is that children and adolescents are still falling behind. They have never made up the treatment gap with adults. An example of the type of innovative research that we need to help us understand why adolescents are being lost and failing treatment was presented yesterday at this conference by a CIPHER grant recipient, Rebecca Hodis. She is studying what makes South African adolescents with HIV more or less likely to be resilient or to adhere to treatment. In her study, the reported barriers to staying in care ranged from the cost of transportation to the clinic to fatigue at having to continuously take antiretrovirals and fear of having HIV positive status disclosed due to stigma. We need more commitment and collaboration like the CIPHER program between clinicians, researchers, and policymakers in order to close the treatment gaps for children and adolescents.
We are failing kids. The pediatric cascade is not successful. We're not as good at testing. We're not as good at treating as we need to be. So there's a kind of momentum, I think, and evidence at this conference that we didn't see 2 years ago or 4 years ago at AIDS conferences that are the elements of doing business differently.
If we could have more pharma companies, coming to you at the IS, coming to the CIPHER program in order to build that competence, globally speaking, I think we would be even more effective. And even if, there are competitors here, we have a single mission, which is to take care of those children. And if we can do that together, that would be great.